Now, unemployment and challenges surrounding the health sector remain top of mind for South Africans. But how do the healers of tomorrow feel about their prospects for the future? South African Medical Students Union National Academic Officer Qiqa Lukhanji joins us for more. Qiqa, very good evening to you. Thank you so much for your time. I mean, as we observe Youth Month, we cannot for once ignore the big challenges young people face, young professionals such as yourselves. There are simply not enough jobs for state doctors. Talk to us about some of your pressing concerns.
All right, thank you so much. As already mentioned, this is Qiqa Lukhanji, the National Academic Officer from South African Medical Students Union, which is SABC for short. Yes, some of the concerns is the unemployment of doctors. But of course, as we are the student wing of South African Medical Association Trade Union. So when it comes to those issues of unemployment of doctors, I think our mother body, which is Samato, can talk better about it, but we stand because we are the future of Samato. Really concerning and put strain to those doctors who are already in the sector.
When you talk about strain, I mean, what about the funding challenges with NSFAS and the kind of dynamics that creates as as studies have shown, the impact of financial stress among students?
All right, thank you so much. So the issue with NSFAS, we've been addressing this issue since last year, that medical students in South Africa are underfunded. The system of NSFAS currently funds students for 10 months in a year, of which the calendar of medical school is 12 months. So we've been addressing this issue. We've had a meeting the Department of Higher Education and Training and also the leaders of NSFAS. And the resolutions were that there's going to be a sort of research by them gather their data from the universities about medical students, calendar, and all the medical students that are funded by NSFAS. So we are still waiting for them at the moment. There was a meeting that was scheduled for the last week, but it has been postponed and rescheduled again. So it's really concerning the issue of funding, but we are hoping it will be resolved. We are still fighting for it. Yes, it affects our future doctors, or let me say the youth doctors.
Okay, we also recently learnt of the death of a young intern doctor at the Prince Mshini Memorial Hospital in Umlazi, KZN, after he reportedly being compelled to work despite allegedly notifying his senior that he was unwell. I mean, that matter has sparked outrage across the medical fraternity. What's your take?
All right, so with regards to that medical intern, again, let me try to emphasize that we have our mother body, which is Samato, which deals with those issues. But with what has been on the media about that issue, I would like to say, like, it's a reminder for the struggles or the problems that are faced by the interns, maybe in our healthcare sector. So I think we can do better and emphasize the fact that our supervisors, seniors, treat our interns in a good way. But of course, our mother is Samato do more.
I mean, If we look at Finance Minister Enoch Godongwana's budget, we know that it can only ensure 800 jobs for the 1,800 unemployed doctors. What does this mean as you look to the future and some of the solutions that you think need to be put in place as a young doctor yourself, and of course the questions about what it holds and what these challenges now mean as we look to the NHI?
All right. So I think we should be trying to put more budget on the health, which is the Department of Health. You see, because it is really discouraging us as the medical students to see that high rate of unemployment. It means that when we are already finished the degrees, there are chances that you might not get employed. So I think our leaders of the country, the leaders of the department, should be trying to budget on that aspect, considering also the initiative. An increased amount of the health care workers, and of course we should be thinking of those who are already there. Being understaffed, it means it's going to put pressure on them, and it's going to affect the health of our population as well, because and also of the doctors who are already in the system.
Unfortunately, we're going to have to leave it there, but thank you for your time. Of course, that quality of that audio not sounding so good, but we do thank you for speaking to us this evening. South African Medical Students Union National Academic Officer Qiqa Lukhanji joining us there to talk about some of the pressing challenges in the space as we look to Youth Month and look at the impact of the doctors, young doctors in the country.